Moving on to our next part of our panel, next part of this program, we have the next session where we have an industry presentation and a fireside chat. And this session is powered by Omron Healthcare India Private Limited. First up, we will have a presentation titled Cracking the Code of Home BP Monitoring, Brain and Heart Health by Professor Dr. Hasmukh Shah, Professor Physiology, Pramukh Swami Medical College, Bhai Kaka University, Karamsad, Gujarat, and India Vice President, Association of Physiologists of India. May I please have Dr. Hasmukh on stage? Please put your hands together for Dr. Hasmukh.
Good morning to all. First, thank you for inviting me here. I want to say thank you to President Dr. Anand Alurkar, Indian Stroke Association, Dr. Arvind Sharma sir, Secretary ISA, Dr. Deepak Saxena sir, Director IIPH Gandhinagar, as well as Apollo Hospital, other institute, and delegates from the pharma company. So I'm going to talk about one of the remedy or tool, how to prevent the stroke. So here, since last few years, we are working on home blood pressure monitoring. So home blood pressure monitoring is one of the best tool to overcome all this problem. As very well said by the Dr. Sudhir Sharma sir, as well as Dr. Deepak Saxena sir. Okay, we have to save our nerve cells, neurons, very fast. Every day we lose, okay, when our blood pressure is very high. So we are going to lose all these things. And hypertension is one of the biggest problem or one of the biggest challenge for all the cardiovascular as well as neural event, as well as you can add for the endocrinal events also. Though there are no notice events, endocrine, but you can sum up all these things. So here neuroendocrine plus cardiovascular events, we are going to very well manage by these home blood pressure monitoring. So here, this home blood pressure monitoring, as all of you know, it is convenient, cost effective, as well as, and it is one of the alternative to the ambulatory blood pressure monitoring. So look here, ambulatory blood pressure monitoring is advisable in the urban area where facility is very good. If people can have, this facility is one of the best way that we record our blood pressure by ambulatory monitoring. But in India, look, most of the people are living in village, as well as when we think in relation to the public health, urban slum is one of the biggest concern in India. So here in urban slum as well as for the village, we need some community health program. And for that, for prevention of the stroke as well as cardiovascular event, here we have to prevent the hypertension, and for that we have to know the blood pressure. We want number. So here, this is the number game, and this number game is addressed by recording the blood pressure, by monitoring blood pressure, and possibly by recording the blood pressure at the home. So nowadays, the world is changing. Everything is coming to your home. And so this is the time where all the healthcare facility is coming to your home. So look here, every day, physician is not going to come to your home, but you have to learn. You have to measure your own blood pressure. So your blood pressure measurement is one of the big challenge. So here, we have to accept this challenge, and here we have to record our blood pressure. So here, there is one scientist, Gensetti. He told that there is a condition, hypertension. In hypertension, as we know, there is alteration in blood pressure is there. And here we diagnose it, but we have to maintain it. Diagnosis, so look here, this is one of the silent killer. And so first step, we have to know our number of blood pressure. After knowing the number, It is not one day game. It is the throughout the life. We have to maintain the blood pressure throughout the life. And one of the challenge, if you go to the studies, 1 out of 5 patient is able to manage their blood pressure. They are adhered to treatment. So poor adherence is very, very common in non-communicable disease, same as in the diabetes as well as in hypertension. So here we have to know our number. We have to manage our number. Now how we are going to manage this number? We are going to manage by recording the blood pressure. So here these are the benefits of the home blood pressure monitoring. So as we know, hypertension, one of the silent killer, and this high blood pressure is going to damage your vessel wall. So once your vessel wall, your smooth vessel wall, initially, when you are not knowing your blood pressure, and when you first become pre-hypertensive, your vessel, there are some strokes on your vessel wall, okay, some trauma to your vessel wall. We are not able to address, we are not knowing this thing because it is silent during initial period. And as this panel of neurologists as well as public health expert told, even a single stroke, okay, even a single stroke is going to damage your cells. And we are not going to get cells again. So here, that's why we have to now, this is a very common that we measure the blood pressure from the beginning. Okay, as there's no age limit, okay? When we see, if you see the public health paper, in adolescent age group right now, high blood pressure is seen. When I see children of my society, most of them are overweight, obese, in flats, as there's no space proper available. So here we are facing this problem from beginning. So we have to address it well. So this home blood pressure monitoring. So here it is as much as accurate if we measure by ourselves as the physician. So here by home blood pressure monitoring, we are going to avoid the white coat hypertension as well as mask hypertension. Many patients, they feel anxious when they visit the hospital. So here at their home, they are stress-free, anxiety-free, and they are going to do the self-monitoring. So here for this thing, awareness is the must thing, and we are going to prevent the stroke as well as the other cardiovascular event by just simple one tool, very easy tool, effective tool, efficient tool, home blood pressure monitoring. So here it is patient-friendly, and these are the challenges for the home blood pressure monitoring. So initially, as we know, in India, ignorance is very, very common. So here we have to provide them the knowledge. Proper training is there. So here, once we train our patient, they are able to manage their blood pressure. They are able to manage their sugar level, temperature. They can do everything, okay? So first thing, we have to give them awareness. So here, awareness and the acceptance. So first event is they have to accept. Okay, so acceptance comes by giving them awareness, by knowledge. And there are so many errors are associated with this technique, okay? So we have to educate them, we have to tell them how to use the validated devices, as well as we give them proper guideline, awareness of the guidelines. And cost is the challenge. So cost is the challenge, but if I say in hypertension, I was diagnosed as a hypertension few months back. When I went, tablet is available for hypertension, just 120 rupees per month. Isn't it big cost? Blood pressure instrument, 1,000, 2,000. I think, if you think at the poor people, they are going to also manage. The cost is the challenge, but it is manageable. Not that too high cost, they are going to pay 1 lakh, 2 lakh rupees for the instrument. Of course, cost is there for the ambulatory blood pressure monitoring, but for the home blood pressure, routine, validated home devices, it is not too much cost, okay, as per my views, okay. So now, blood pressure monitoring. So how to measure? Technique is also one of the best step or remedy, not only device, okay. So we have to educate our patient for the training. So here, first of all, when patient is coming to you, advise him to take 5 or 10 minute rest for blood pressure monitoring. Avoid for any stimulant. Here stimulant, tea, coffee, tobacco, any oral chewing gum, as well as any alcohol, whatever, or food also. So here avoid these things before 30 minutes to 1 hour. Then bladder as well as bladder must be empty. Ask him to go for the washroom. Then we are going to measure the blood pressure. No toxic material, anything. And then we are going to take blood pressure monitoring. And before measuring blood pressure, we give them education that we are going to measure your blood pressure. And after measuring blood pressure, minimum, we are going to measure the blood pressure 3 times during single visit with the distance of 2 minutes. And then we are going to take if there is no difference around 4 or 5 millimeter of mercury, we are going to take that readings. And then we are going to move forward. So here, as we compare the office blood pressure, by home blood pressure monitoring, we are going to take multiple readings. We can take in the evening, morning. It is up to us, okay? So it is really one of the comfortable method. We can do at our own time, as well as at our own convenience. We use this instrument. We can carry this machine with our own, and we are going to record. So here, the benefits of this type of the method, it is more reproducible, and there are more patient outcome, positive patient outcome is associated with the home blood pressure monitoring. And here we are going to manage the organ damage, okay? Hypertension mediated organ damage is prevented, okay? This is one of the key steps for prevention of the stroke, as well as other cardiovascular disease, as well as we are going to protect our eyes, our kidneys, our brain. Because when your blood pressure goes very high, okay, from 140, if it is going 150, you have to manage it. So when I was hypertensive, my blood pressure was simple 130. So there are 2 types of physicians are available in Ahmedabad, Gujarat, young as well as old, okay? Old, they told me that you take 3 months weight reduction program and on, do this. But young people, they believe, immediately start the treatment, okay? Because weight reduction program are always failing in India. No one is able to reduce their weight. So it is advisable you can start your treatment from first day. You can do blood pressure monitoring at home. So here, awareness as well as acceptance is the key thing. So here, we can measure the blood pressure, mainly upper arm, recording, because we can measure in few different areas, but the upper arm recording is advisable. We can assess the arm. Patients are able to manage, they are able to feel their pulse after the training. So this is the good thing that we measure the blood pressure at home. And here posture is the main thing. So here, always advise a patient to do in static posture. Because when you are changing your posture, your blood pressure is going to change. Here we are going to advise them for the postural hypotension. Okay, so when you are changing your position, blood pressure is going to change. And that's why we are going to take the multiple readings. Now limitation, as I told earlier, limitation, one of the major limitation is the patient education, acceptance and education. So here, this is one of the major limitation. And many a time, when patients are doing it first time, anxiety. Patient anxiety is the key step. And in our country, we become anxious by our surrounding environment. So here, environment is right now, we are too much have news regarding the NCDs, stroke and heart attack right now. Nowadays, we are reading in newspaper every morning, news of the heart attack. So we are really very worried. And even our neural symptoms are most of the time misdiagnosed as a heart symptoms, cardiac symptoms. And we are rushing toward the cardiologist, not toward the neurologist. So this is also a big challenge. So here we can do these things by the proper awareness. And here, many times we record the blood pressure at the night. So here we can avoid, it is advisable we record the blood pressure in the morning. And this is some marginal disadvantage. So here, this can be corrected properly by home blood pressure monitoring. So here, prerequisite for the home blood pressure monitoring. Okay, so here, patient information, I told everything. So here, patient information and education, as well as we have to select the proper device. So this is the key step. Proper device, validated device is advisable. So here, if you go to the website of the European Society of Hypertension as well as International Society of Hypertension, there are guidelines are available. So guidelines for the various instruments are available. So here, if you check in India, most of the validated devices are available from Omron only. Because right now, new companies are coming. But Omron is the old one, and all the instruments are properly validated devices are available. So your correct measurement is the must thing, and device. So here, this is the cuff size that we can tell to our patient, this cuff is required. So here, mainly for the pediatric age group as well as for the obese individual. Okay, we have to select the proper cuff size. I'm not going this. So here, as I'm speaking on behalf of the Omron, here in Omron, one device is available to detect the arrhythmia also. So here we can detect the arrhythmia along with the home blood pressure monitoring by one single device, okay? So here, by this device, we are able to know is there any abnormal rhythm is going or not. We can detect the tachycardia as well as we can detect the bradycardia. So here few people are very prone to the arrhythmia. So here people, those who have heart failure, high blood pressure, angina, myocardial infarction, valvular disease. So here in few people, those who are obese, aged individuals, patient with the cardiometabolic disease, those who are regular on drinking alcohol as well as smoking. So here this type of the patient are really prone to the changing their cardiac rhythms, ECG rhythms pattern. So here we can easily correlate with this new device. So here by this device, we can get the complete care of the hypertension along with the arrhythmia. So here, it is really easy to screen. So here, in this device, we can get with the mobile application. You can download the application in your mobile phone and you can record these data on your mobile phone. So here, it is easy to record blood pressure as well as your ECG rhythm, and it directly gives the result. So we can record easily by this device. So here, as already told here, the risk of the stroke is 5 times more than in patient with the hypertension along with the arrhythmia. So here, if we can reduce the risk by proper acceptance of this method and instrument. So your number of arrhythmia patient is increasing. So every day, when we see in newspaper, patient of the heart attack, actually right now we are not knowing, so many patients died, sudden collapse. We are not knowing whether reason is maybe electrical or maybe vascular side. So here, it is a time to know whether your heart rhythm is going proper or not. So we can do this by the instrument or by regular checkup. So here, this is the Omron complete device here with the ECG along, so we can detect the arrhythmia very well in advance. So here, this instrument is also validated and we can suggest this instrument to your patient. So here, for that we want proper cup size instrument as well as this is the proper pre-validated instrument, and they can do their own after their awareness. This is the website of the British Hypertension Society. Here it is on their website. It is available on all European Society of Hypertension, American Hypertension Association, as well as International Society of Hypertension is available. Along with this guideline, Indian Society of Hypertension is also working on this, and they have also released their guideline recently. Though this is not advised, this arrhythmia instrument, it is coming, but it is coming in few years, 1 or 2 years, because we do not have proper guideline right now for when we say hypertension for the Indian guideline. One guideline is released and it will be modified in coming years by they are doing the regular workshop as well as meetings, and we have guideline very soon. So how to choose the validated monitor? By website it is available. We can select the validated by the number there is a number on each instrument of each company, and we can get the validated instrument. So thank you all for listening me.
Thank you so much, Dr. Shah, for that wonderfully insightful presentation. I'm sure the audience had a lot to take away from it. I would like to now invite Ms. Pinky Chahar on stage to please felicitate Dr. Shah. Can we have a round of applause? Thank you, Dr. Shah. For the next part of this session, we have a fireside chat where we will be joined by two experts to discuss the control of hypertension for primary prevention of stroke. Hypertension is a leading risk factor for stroke, and its management is integral to stroke prevention. Please join me in welcoming Dr. P. Ganesh Kumar, Scientist E and Deputy Director, ICMR, National Institute of Epidemiology. Can we please have Dr. Ganesh on stage? Please put your hands together for our next panelist, Dr. Kumar Arya, Senior Neurologist. Dr. Kumar, please join us on stage. Dr. Kumar would be leading this discussion for us today. Over to you, Dr. Kumar. Let me just... Sure. Please, I hand over the session to Dr. Kumar Velu now.
Good afternoon, ladies and gentlemen. It's a follow-up of what Dr. Hasmukh was speaking about hypertension. And there was a point made by Dr. Anand in the morning regarding the epidemiological data regarding hypertension in our country. Now, to highlight further on the subject, we have Dr. Ganesh Kumar, who has been introduced to this audience already. Ganesh, could you share your insights into the latest epidemiological data regarding hypertension and its relationship to stroke, particularly in the Indian context?
Thank you, Voice of Healthcare and Indian Stroke Association for inviting me. It's been a pleasure to share a stage with you, such a veteran. I'm coming from Indian Council of Medical Research, National Institute of Epidemiology. There, it's a 25-year-old organization where we are working on various public health problems and as well as capacity building measures. In this particular initiative on NCDs, one important area we have chosen is hypertension. We started a large initiative of it. But before proceeding about that, I wanted to share that where currently India stands. And that for that question, we need to understand, do we have that kind of a risk, what it is being portrayed? We conducted a national NCD monitoring survey. And as per this national NCD monitoring survey, this is what the findings we have identified in that. Can I have the slides on the stage? Yeah. Okay. So these are all the major risk factors, everyone is aware about it. But where do we stand? If you think about tobacco, every 1 in 3 individual is consuming tobacco either in smoke or smokeless form. In terms of alcohol, which is another important risk factor, 1 in 6 individuals are consuming an unsafe amounts of an alcohol, which is another important risk factor. And if you see about, this is very important, how many individuals are the proportion of people consuming recommended fruits and vegetables, what our survey has seen that none of them were consuming recommended fruits and vegetables. The most important major problem in terms of high salt diet, almost everyone is consuming high salt diet, which is more than 5 grams per day. The median consumption, it's around 8 grams per day is in our survey we identified, which means everyone is having an equal risk of that. And in terms of physical activity, like every third individual, 1 in 3 individuals are physically inactive. And most important issue where I am coming in terms of hypertension, 1 in the third individual, more than 18 years and above. If you 30 years and above, then I will say every second individual is having elevated blood pressure. And means it get into the risk of that. In next 10 years, 1 in 10 individual are having an high risk of landing up into myocardial infarction, heart attack, or stroke, which is a brain attack, which is going to be a major worrying thing which we have identified. And recently we published in Nature.
Yeah. So we know that hypertension is the leading risk factor for stroke, more so in ischemic stroke. Now coming to the next question, having seen hypertension as a risk factor, what do you see are the key challenges in controlling hypertension, and how can we implement effective preventive strategies to reduce the incidence of stroke?
Thanks for that question, sir. So I want to share much more data about what is the risk which is spreading across this particular area. These are the top risk factors for cardiovascular disease and death. If you just observe here, the number one leading, I think the slides are not on the screen. Excuse me. Yeah. If you see that the number one leading risk factor is raised blood pressure. This ranked according to the number of deaths contribute to cardiovascular disease deaths by risk factors, which includes stroke also. Then comes air pollution. This is based on the World Heart Federation report, World Heart Report 2023. Then comes elevated LDL cholesterol. Then comes tobacco use. Then comes high fasting plasma glucose. Then high body mass index and low physical activity. If you see this, the amount of deaths caused by that hypertension alone is very, very high. Even when you combine the rest of the risk factors, it will not compensate that. Proceeding to that, in terms of one important epidemiological data based on our national NCD monitoring survey, the prevalence of hypertension in India more than 18 years is 28.5. We can come around, say, around 29%. But what actually the most important insight we have got into is the cascade of the care. Imagine there are 100 people with the hypertension. Of the 100 people in hypertension, only 28 are aware that they have hypertension, which means nearly 75% of them are not aware that they have a raised blood pressure. Okay, the story does not end there. What it proceeds further is that of them only 14 are under treatment. So even though there are some, say, like 28 who are under treatment or diagnosed, only 50% of them are under treatment. The worst part comes, only 12% are under control. What do you expect when you have an uncontrolled high blood pressure, which is nearly 88%, nearly 90% in our country? What do you expect? It's a huge amount of an incidence of stroke, and as well as the heart attacks will rise. And that is happening currently in our country. So, what if you treat 1 crore people with hypertension? Just assuming that in a state like Tamil Nadu, like when I'm just trying to project a figure, there are 1 crore hypertension. If you treat them, what will happen? In 5 years, you will prevent some 75,000 deaths. Now, please think in the reverse of it. If you don't treat them, the same figure which I have shown previously, if you don't treat them, you are going to lose some 75,000 precious lives. And in 10 years, you will prevent some 1.5 lakh deaths, the same in terms of reverse of it. And in 5 years, you will prevent 2.5 lakh heart attacks and strokes. This is the reality. Now, instead of prevention, if I want to raise the alarm, just I am reversing it. We have some nearly 90% of the people with high blood pressure who are not under control. All these things are inevitable. This is the truth which I wanted to share. The challenge which you asked, sir, like, if you treat one patient for 365 days, all you have going to spend in a generic cost drug is 200 rupees per patient for treating 365 days. Compare it when you are going to thrombolize that patient or you are going to put a kind of a stent, it is going to cost huge and majority are out of pocket.
Okay. You know that it's cost effective also. And I'm sure I'm speaking to a district which is very cost conscious. Coming to the next question. You are from ICMR. What are the initiatives that ICMR is taking at addressing hypertension stroke connection?
Thanks, sir. So, if you see this slide, in 2017, we started an initiative called India Hypertension Control Initiative in 25 districts covering 5 states. And now we have implemented this India Hypertension Control Initiative in 26 states covering 145 districts, where we have put the 46 lakh patients on protocol-based treatment, which I will be talking later. This particular initiative is been running in our country, which is primarily targeting improving the primary care of hypertension management at the public health facilities, government hospitals. And we adopted a WHO heart strategy. It is a multi-partner initiative, which is by Government of India Ministry and as well as WHO Country Office India, state governments, including Gujarat, and which we had implemented. You could see these are the states where we have implemented in our phase 1 and phase 2 states. And we recently, just last month, we started this in Jammu and Kashmir also.
Good. Now, with this, what does the ICMR propose as a policy change to promote hypertension control as a preventive measure?
So, this is really tricky. Many of us will often say that, okay, right, this is an easy affair which can be implemented elsewhere, but it is not in our experience, which we did in past 5 years. What our experience says is that, like, the WHO HEARTS package, when we try to devise it for the Indian context, these are all the strategies which we have identified. One is that is protocol-based treatment. If you have protocol for malaria, if you have protocol for tuberculosis, then this much high prevalent disease, you need to have a protocol for hypertension. And we made a simple protocol, not guidelines. Guidelines runs in 50 or 500 pages. We made single page protocol. Second is that team-based care, where nurses, physicians, pharmacists, even community health officers at the sub-centers were trained in that. So any patients who are closer to the community can get the drugs refilled, checking their blood pressure from the health and sub-center. Medication supply is a major challenge, which I want to acknowledge this problem. Please understand that we've been always talking about that, say, a junk food or as well as an aerated drink is available even at the grassroots level. But the reality is that we could not equip our primary care and as well as health and wellness center with the generic, cheaper antihypertension drugs. The cost of one amlodipine 5 milligram in one of the state generic drug cost is 9 paisa per tablet. This is the cost. It is nothing about the cost. It is about the planning and execution of it, which is the most important. The fourth is the patient-centric care, and where the patients should not go round and round in order to get the care, and that's why we brought that closer to the community by training health and wellness centers. And huge numbers, so we implemented information system for that, and also BP monitors. What we observed in our study is that none of the primary health centers, forget about primary health centers, district hospitals, forget about district hospitals, medical colleges, not equipped with professional blood pressure apparatus. The concept of professional blood pressure apparatus itself has totally gone off that. So we introduced professional blood pressure apparatus into the primary care setting. So these are all the policy level changes which we did in these 26 states. And in these 26 states, all of them are having a protocol in the government health system at the primary care. So we are still need to do a lot of more work in the private sectors.
Yeah, I will all agree that the planning is in, the implementation is yet to be done effectively, even in these 26 states. Now, coming to the next question, can you tell, you mentioned about something about digital interventions. What have you done from this thing on digital interventions, or as Dr. Hasmukh was alluding to, continuous BP measurements?
So, thanks. So this is a digital health era, and digital health literacy is still low. And of course, there is a lot of noise on digital health. There is a lot of noise on artificial intelligence and machine learning. To be honest, in the ground level, at the implementation aspect of it, we don't have that much amount of digital tools or any other machine learning or AI tools which is at the point of care. Very, very, very few. But what actually I believe is that like patient wearable monitoring devices are coming up in the market at a cheaper price. This is going to be cuffless. So there is one study by University of Sydney. They conducted a cuffless blood pressure monitoring wearable wrist monitor, and validation protocols it aced it. But currently what we do have is all with cuff only, and this particular wrist blood pressure apparatus is also with cuff. This is going to replace a huge amount of stand in terms of ambulatory blood pressure monitoring in a clinical setting, which is not at all patient friendly. All these currently available ambulatory blood pressure apparatus, 24 hours ambulatory blood pressure apparatus, has failed in all usability and user-friendly settings. Rather than more of diagnosing, it created a lot of false signals. This is the truth behind it. Usability from the patient side is very least. This is one thing which I am expecting is going to reform in terms of hypertension space. The second is that the cuffless BP ambulatory apparatus, which I mentioned, that there's a recent publication which has clearly mentioned about that this cuffless BP ambulatory has followed some of the international validation protocols and sounds to be promising, closer to that ambulatory blood pressure apparatus, which is the gold standard of that. But honestly, I want to say that in India, huge number of patients where we are going to treat and how we are going to monitor. Please remember, this continuum of care is the most important key. You are going to treat the patient throughout the lifetime, which means you need to monitor him continuously. If the patient has come for follow-up or not, whether the patient. So, we need program tracking on treatment outcomes. No one is talking about control, which we need to monitor it, and this control is a dynamic phenomenon. Why I am just talking about where this digital interventions has to happen on patient monitoring and having dashboards at any clinic setup is that because of the numbers. In a typical hypertension control clinic where you are treating 3,000 hypertension patients, assuming 50% are only under care and 1,500 visits every year, and assume patient visited at least 6 times a year, there are nearly 9,000 data points are generated every year. And you imagine that the same in 10 years, the same in terms of 20 years, huge amount of data points will be being generated that. Just convert the same thing to a larger setting like in a state. Assume that in a state which is having 1.2 crore hypertension patients, and say like 60 lakh are say under care, and which is 50%. Assume 50% are in government sector, it's 30 lakh. Assume that the patient visited only 6 times in a year, 1.8 crore visits. And when I am taking 3 data points, you are going to create 6 crore data points. I don't think so pen and paper is going to make a sense here. And that's where we really require this kind of a digital technology to monitor the patient. If you want to know whether this patient was under control in the previous visit, if you want to know what was the under medication and whether the patient has visited once in 3 months in the past 2 visits, which decides the control of hypertension.
Yeah, that reminds us that National Medical Commission has said that all our data, be it in government sector or private or clinic, should be digitized in the next 3 years. That's what I think the letter came out last year from the National Medical Commission. Now, having seen this, now what are the initiatives from the public health awareness point of view that you feel pose challenges in these conditions?
So, there are important challenges when I am trying to tell about awareness related to hypertension, especially on treatment outcomes. We usually see these 4 P's: patient, provider, program manager, and policy maker. What we observed in the past 5 years while implementing India Hypertension Control Initiative, we have been interacting with the policy makers, program managers, doctors, and also as well as the patients. What our research finding shows is that the awareness on 2 important things. They don't know what is actually control, which means target. The treatment targets and treatment, what is a target which they have to achieve for control was largely missing. I think there is something we need to do on that right from all, widely we need to publicize this particular part. The second important issue is that we've been embroiled with a lot of non-pharmacological measures, assuming that one or other day it will work. Definitely it is important. But as a large scale implementation, when you want to hit this disease, you need to act fast. And whether you like it or not, whether fortunately or unfortunately, pharmacological treatment which you need to initiate at the earliest is our mainstay, which prevent a lot of heart attacks and stroke. And betting on non-pharmacological will definitely take some more time. By the time some lives will be lost. So we need to think and act fast in diagnosing it.
Yeah. Pranayamam is a very important non-pharmacological method. I advocate to all my patients of stroke to do pranayama at least 5 minutes in a day. That's enough, if that could be. Because whatever you try and tell your patient should be practicable at the patient's end. Now, Ganesh, you are an avid researcher in this field. Now, what do you feel are the pinnacle recent advances and advancements in hypertension management which will impact the incidence of stroke?
I have to be very humble to say that when I am going to utter these important recent advances, not to super glorify on some of the things which may not come into existence. We need to go to our basic understanding what actually can reduce this particular problem or the challenge, and these are the possible strategies. We have huge amount of evidence. The gap from evidence to practice is very huge in anywhere else across the world. I'll just simply say one simple example is that calcium channel blocker, amlodipine 5 milligram, cheapest generic drug available as a first line of therapy. It took nearly 20 years to come into practice, despite there was a huge amount of evidence. The same, I will just stick on to that. There are a lot of trials which is very much promising to start polyfill management, administering polyfills as a first line of therapy for hypertension management. When I say polyfills, it's a combination of drugs. What currently these trials have, they have included amlodipine, calcium channel blockers, ARBs, and as well as diuretics in low dose and make it as a single pill. What are the advantages they identified is that the expected target blood pressure is achieved within no loss of time. An important phenomena they have identified in these trials, many drug trials, is that treatment inertia, which is in practice, borderline effect. The physician is not willing to escalate the therapy, though the patient is not achieving the control, thinking that the one or other day that patient will achieve, because anything more than 7 days plateau effect, it is not going to achieve. In polyfill, the advantage is that you achieve the hypertension target, the blood pressure, which in a low loss of time. Second, patient tracking and assessment. We need to have models. The previous speaker mentioned about home-based monitoring. We need to have community-based models. We are executing a peer support group level monitoring, giving a BP apparatus at the village level to check the blood pressure of the hypertension patients regularly. And third is programmatic digital interventions, which I have mentioned earlier.
Yeah. Now, can you share some examples where hypertension has been successfully controlled, or the interventions that have been effective in reducing the incidence of stroke?
Yeah. So in our India Hypertension Control Initiative, we achieved 50% of the people with hypertension overall in average in the country have achieved control. This ranged from 90%, this ranged from even 20% of that. So the key learnings I wanted to say is, one is protocols. This is a simple protocol, Gujarat state protocol, which we have devised along with the specialists who are in the state. And it has 3 drugs, simple to procure, start with amlo, go to telmisartan, and end with chlorthalidone. Our experience says that 70% of the patients were under control by just amlodipine 5 milligram. Second is standardizing the measurement at primary care. This we have pasted in all our primary health center, how to measure a BP, which means put a chair on that. I'll just take a minute. And third is that using professional blood pressure apparatus. Here, the most important thing is that the awareness of professional BP apparatus was largely missing, not only in the government side, but also in the private side. I want to honestly and humbly admit that. So, any of these validation protocols, and you can check all the professional BP apparatus in the site, stridebp.org. And patient-centric management, which I have mentioned, and closer to the community.
Yeah. Coming to as a researcher, what do you feel should be the final thoughts?
I just want to give these few messages on that based on our 6 years of implementing India Hypertension Control Initiative. We need to screen everyone who is more than or equal to 18 years. Blood pressure at least, in order to for primary prevention of stroke. Treat at the earliest at least by 30 years. Otherwise your time has been lost. Continuously monitor the blood pressure at least once in 3 months. And treatment goal, at least systolic blood pressure 140 and diastolic blood pressure less than 90 millimeters of mercury. And we need to educate widely on the cutoff these values and early signs of stroke.
Thanks, Ganesh. That was a very wonderful and lucidly put across the various initiatives in hypertension control and thereby reducing stroke. I'll take a minute off. I just formulated the 10 commandments of stroke prevention. The 10 commandments struck me because most of us are interested in numbers. Okay? One is control your blood pressure. Next, control your blood sugar if you have one. Check your body weight and bring it to ideal limits. Stop smoking. Don't allow others to smoke in your vicinity. Check your bad cholesterol and control it. Regular exercise. Eat healthy food, not the so-called food on the street food. And when a patient asks for snoring, in my hospital I formulated a primary stroke prevention where I have included sleep apnea as one of the evaluating parameters. And the last but not the least is air pollution, which is coming into more and more. In fact, one of the reasons for rural high incidence of stroke was particularly air pollution in that place where using firewood. And last but not the least, annual checkup every year past 35 for 4 numbers. If we can do this thing, I think we can proudly say, jeetenge hum against stroke. Thank you.
Thank you.
Thank you so much, Dr. Ganesh and Dr. Kumaravelu, for that wonderful presentation and fireside chat. I'd like to request Dr. Kumaravelu to please felicitate Dr. Ganesh. I would like to now invite Ms. Pinky Chahar on stage to please felicitate Dr. Kumaravelu. Can we please have a round of applause? So please come in the front for a group picture.